fluid being produced and maintained in this constant amount. The cerebrospinal fluid functions as a cushioning effect on the brain. For example, the brain has a weight, the normal human being has a weight, brain weighing almost 1500 grams or 1.5 kilograms. But due to this cushioning effect of the cerebrospinal fluid, as we are all familiar with the Archimedes principle, that the effective weight of the brain gets reduced to almost 50 grams. Why it is so? Because all the cranial nerves, they are emerging from the base of the brain. And if the pressure of the brain is increased, the cranial nerves get compressed, and there would be the signs and symptoms of the cranial nerve palsy. So, nature has provided us mechanism of the cushioning effect of the cerebrospinal fluid, that the effective weight of the brain is reduced, so that cranial nerves and all the vital centers which are on the base of the brain, they are saved. Now, ladies and gentlemen, what happens if this intracranial pressure, if this cerebrospinal fluid level increases and causes a rise in intracranial pressure? It will compress the brain. Like you can see, there is a bottle of water. It has water in it in a constant amount. If this water is increased, it will compress it, and pressure would increase. So, ladies and gentlemen, when the pressure on the brain would increase, it will cause first of all severe headache, and then the cranial nerves which are emerging from the base of the brain, they get also compressed, and we will get the signs and symptoms of the cranial nerve palsy. For example, if the intracranial pressure is rising, patient will present with headache, and afterwards, patient will present with blurring of the vision, downward vision loss or blurring of vision. Why is so? Because the optic nerve is the direct extension of the brain. It takes all the meningeal waves, all the waves of pyometer, arachnoid and durometer with itself. And whenever there is increased intracranial pressure, it will also rise in the subarachnoid space of the optic nerve sheath, and it will cause papilloedema and blurring of the vision. Again, one more cranial nerve which is more prone to get injured is abducens nerves. As we all know that abducens nerve has got the longest intracranial course. This nerve has got the longest intracranial course, and whenever the pressure on the brain increases, this nerve is most likely to get compressed by this increased intracranial pressure. Now, ladies and gentlemen, you all know what would be the signs and symptoms of the increased intracranial pressure. The patient will present with headache. There might be the blurring of vision to the optic nerve involvement, and there might be abducens nerve palsy. Patient might present with the diplopia in the lateral base. Ladies and gentlemen, this intracranial pressure is rising because of any pathology in the brain. Either a space occupied here might be obstructing the outflow of the cerebrospinal fluid, or it may be compressing the ventricular pathway, or there may be any other meningitis like signs and symptoms which would, there would be space occupying here, or intracranial tumor which would be obstructing the flow and causing rise of the intracranial pressure. Now, a patient presents to me. Patient presents with the signs and symptoms which are consistent with the increased intracranial pressure. What would you suspect? You will suspect any space occupying here. But what if you do the CT and CT is absolutely normal? What could be the cause? We call it pseudotumor cerebri. It's pseudotumor. It's not actually tumor. Patient is presenting with the signs and symptoms of the most likely suggestive of tumor, but there is no brain tumor. We call it pseudotumor cerebri. Now, ladies and gentlemen, pseudotumor cerebri is the increased intracranial pressure in the absence of tumor or other disease. So, this increased intracranial pressure could be increased by any space occupying event, but there are some other factors which would increase the intracranial pressure without any obvious pathology in the CT scan. We have all read in our ophthalmology classes as well in 4th year that there is a substance whose toxicity causes a rise in intracranial pressure. Can anybody know?
Vitamin A.
Yes, vitamin A. Hypervitaminosis A. Vitamin A toxicity causes rise in intracranial pressure without any space occupying here. We call it hypervitaminosis A may also lead to pseudotumor cerebri. There are other causes like oral contraceptives. They may also lead to the pseudotumor cerebri, and we have already read in the pharmacology classes that tetracycline is an antibiotic which also causes pseudotumor cerebri like symptoms. So broadly speaking, pseudotumor cerebri can be classified into two categories, primary and secondary. In secondary, we have a history of some substance like steroids, steroid withdrawal, like hypervitamin A, like tetracycline. We can correlate this thing with the increased intracranial pressure. But in primary, where we have no any pathology there, no any, you may say, you know any history of any substance, we call it primary pseudotumor cerebri, or also known as idiopathic intracranial hypertension. It most commonly occurs in the women of childbearing age. Typical scenario would be like a 25-year-old woman presenting with signs and symptoms of increased intracranial pressure. She is oral contraceptive, her BMI is greater than 30 might be, and you will do the fundoscopy, and fundoscopy there is papilledema, then you will do the CT scan, there is no abnormality. What would be the most likely diagnosis? It would be pseudotumor.